I'm Amber Mitchell, and this is my NUR230 physical assessment midterm video. Walk in the room, wash my hands, introduce myself, close the privacy curtain. I'm Amber, I'll be your nurse today. I'm going to do a quick exam from head to toe of you. I'll start with your head and work my way down.
Yes, ma'am.
Can you tell me your name, date of birth?
Yes, my name is Fred Sanford, October the 9th, 1941.
Okay, Fred, that's what I've got here. Okay. I'm going to put some gloves on. You just tell me if anything I do is uncomfortable or bothers you in any way, and we'll make adjustments. I'm going to put my gloves on. If you'll tilt your head down a little bit, I'm just looking through here to make sure you don't have any abnormalities. No skin color changes, hair's thick. It's not brittle. You don't have any balding, no bald spots. Everything looks like it's supposed to. Skin color is good. You don't see any edema. We'll look. Can you open your eyes? Okay. Good. I see you have a rather round face. Nice and symmetrical. No drooping on one side, which could be signs of a stroke. That's why you're looking at all that. Your head is in midline position. Trachea is in midline position. Hair looks good. You don't have any lesions or mashes. Is it tender when I palpate?
No.
Or when I feel your head, do you feel any tenderness?
No.
Nowhere? Okay.
It's empty.
There's no depressions, no infestations of bugs. I'm going to palpate your temporal artery. Is that tender?
No.
Okay. We'll palpate your lymph nodes. Start with your preauricular lymph nodes. And then we'll put anything. Go down to your post-auricular. Back to your occipital. Back forward to your tonsillar. Do you still have tonsils?
Yes.
And your submandibular, submental. Your anterior cervical, posterior cervical, and clavicle. Okay.
You've done a good job.
Oh, thank you. I'm going to assess your cranial nerve 5, which is your trigeminal nerve.
Okay.
Would you come back down? Relax. Back down. Okay. And then, can you feel all this?
Yes.
Okay. Can you smile? Raise your eyebrow. Frown.
What's so funny, nurse?
Can you puff your cheeks up? Pucker your lips. That's cranial nerve 7.
Why are you laughing?
That's your facial nerve. I'm gonna inspect your ears now. They look like ears. No abnormalities, masses, lumps. No abnormal colors or lesions. And then I'm going to get my otoscope and I'm going to look inside your ear. Okay. I'm going to pull your auricle up and back. And I don't see anything. I see your tympanic membrane. No abnormal collection of fluids. This one up looks good. Palpate your peanut and your tragus. Does any of that feel tender?
No.
Okay. And then I'm going to whisper something over here and you tell me if you hear it. This is for cranial nerve 8, which is your vestibular cover.
Yes, I hear it. Yes.
Alright, and then I would do the Weber and Rennie test if I have one. We'll use it. I hit it, place it up there. Do you hear that?
Yes.
Okay. Place it over here, and what's going to happen is when I hit it, you're going to tell me when you stop hearing the vibration. Okay?
Okay.
Okay. Okay. And now I'm going to inspect your eyes. Your eyebrows look symmetrical. Your eyelashes are good. No falling out. Eyes look good. Now I'm going to look at your eyes. Look straight at me. Now look at your conjunctiva. I don't see any scarring or redness. No discharge. Is that tender?
No.
Have you had any recent injuries for eye pain?
Oh man, just close up vision every now and then.
You need reading glasses.
Reading glasses, 1.5s, I think. Nurse.
You're getting older. You're born 41, friend.
Yes, 41.
Okay.
Thank you.
You're welcome. You need to get frequent eye exams. Do you ever go to the eye doctor?
Yes, once a year.
Okay. Do you have to wear glasses?
Yes.
Prescription glasses? Or
Yes,
okay.
just reading glasses.
Okay. Well, maybe we need to go. When is your next exam?
In December.
Okay, good. All right. Next, I'm going to check your vision with the wheel. You ready? You watch my pen. Follow it.
Lord, that should go awful fast.
That was cranial nerve 2 that we were checking. That's your optic nerve. And now we're going to check cranial nerve 3. And I'm going to shine this light in your eye. You look at me.
Oh.
You look at me. And I'm going to shine my light
Sorry,
in one eye and make sure that the other eye constricts as well. And it does. It does. I'll come around this one. And they both constrict. Very good. So that's called convergence. That's accommodation and convergence with cranial nerve number 3, which again is your oculomotor.
Oculomotor. Okay.
Yeah. All right. Your conjugate gaze. That's 3, 4, and 6. Okay. And then let's do your nose. Your nose is midline, it's straight, it's on your face, it's not crooked. Have you ever had a broken nose?
No.
Have you ever had a deviated septum?
No.
Okay. No polyps?
Mm-mm.
Any kind of nasal surgery?
Just blackheads.
Okay. So I'm going to look in your nasal cavity. Looks good. No
Lover.
bleeding, no lesion, no polyps that I can see. Septum is midline, doesn't appear deviated. Now I'm going to palpate your sinuses and palpate your frontal. Is that tender? And your maxillary. How's that? Is that tender?
Mm-hmm.
It is tender?
Just a little bit.
You may have some sinus issues. Now I'm going to palpate for. Let's inspect your lips and your gums. Lips look good. Can you smile? Let me see your teeth. Teeth look good. They're dentures.
Oh, dentures.
Mucosa looks. Say Everything looks good. Stick your tongue out. Feel it. Finger.
Huh?
Stick your tongue out. The uvula's in place. No.
I do have my tonsils right.
Yes, your tonsils are in there from what I can see with my light here.
Light. Yeah.
Your posterior pharynx is normal color, pink, moist. Your tongue looks good. Can you up it up and say lift your tongue? Okay, looks good.
What is that, nurse?
What?
What was you looking at under my tongue?
Just make sure you have the...
Oh, that little piece of meat. Yeah.
And then, let's palpate for TMJ. Not TMJ is.
No, I do not.
Well, say ah.
Ah.
Bigger.
Ah.
Not louder.
Oh.
Open your mouth bigger. There you go. Okay. Close it. You have TMJ.
Oh, do I?
Yeah. Do you? Yeah. You have a click.
Is that a click? Is that good or bad?
It doesn't matter. I don't feel any subluxation. Is it tender? Everything looks good. Open again. Open again. Let me see your uvula. Normal movement. It rises symmetrically with phonation. Tongue is midline without fasciculations. And let me inspect your skin. We'll look on your chest. No lesions. Warm, dry skin, not moist, not too dry. Skin turgor is good. Skin turgor is good. Meaning dehydration. Next, I'm going to, we did palpate your trachea. It is midline. I'm going to palpate your thyroid gland. I'm going to do it from behind.
Okay.
So I will come behind you on the exam table.
Do I need to just turn?
No, that's okay. Oh, line up. No swelling, no edema. Alright. Now I'm going to palpate your carotid artery. I'm going to do it one at a time so you don't pass out.
Okay.
That's equal. And then I'm going to listen to your carotid artery for any bruise. No swishing, no signs of a bruise. Alright. Can you pull your head down to your chest? Can you extend it back? Can you look to your left? Can you look to your right? Okay. This is cranial nerve number 11. This is the accessory nerve. Can you shrug your shoulders? Just your shoulders, not your head. Okay. Good. That's equal. Now, I'm going to, I don't know how I'm going to do this. Unless, can you turn?
Do I turn? Which way?
Can you turn? Kind of sit sideways. Since you don't have a shirt on, I'm going to look at your back.
It's hard to kind of sit level, you know.
That's okay. I'm looking at your back.
Okay.
Color, temperature, any masses, tenderness anywhere.
No.
As I palpate. No bruising, no scars, no lesions, no signs of edema. While you're there, I'm going to listen to your lungs. You're not using your accessory muscles. You're not in tripod position. No nasal flares, retractions. No signs of tachypnea or cyanosis. I'm going to listen to your lung fields. Take a deep breath, starting at the scapula, work my way down. Lungs are equal. No adventitious sounds. Breathing is symmetrical. No deviated trachea. No unilateral expansion. I'm going to palpate your lungs now.
Feels good.
You have 3 lobes on your right side and only 2 lobes on your left side. Did you know that? You
Now
have room for your heart on your left side.
Oh, okay, so it gives room. Okay, that makes sense.
Exactly. Because your heart is more on your left side. It's got to have some room.
Okay.
Okay. Mental health. You got it?
What do you do now?
Okay. Now what's going to happen is you are going to say 1, 2, 3. Okay?
1, 2, 3.
Say E.
E.
Say 99.
99.
Say 99.
99. 99.
Okay. I was assessing for egophony, bronchophony, and petriloquy.
That sounds good.
Okay. Okay, then turn back around for me.
Okay. You're doing a fine job.
Thank you.
Nurse.
Fred.
Your name is Amber, right?
Yes, sir.
Okay, you're doing an excellent job.
Again, I've checked your interior chest for skin color, for no excessive dryness or moisture. It's pink, no redness, no bruising, no swelling or edema. Let's see. Everything is symmetrical, no deformities, no scars, no abnormal muscle movement, no accessory muscle use. And I'm going to palpate your chest. Okay. I'm going to palpate your liver. Any tenderness?
No.
And your spleen. Thank you. Any tenderness?
No.
Good. And now we will palpate. Can you? Let's do full expansion. And I'm going to listen to your lungs in the front. Okay.
You've done a great job.
Thank you. So again, on your right side, there's 3 lobes.
3 lobes.
So I'm going to listen 3 times. You need 3 breaths on your right, 2 on your left. Ready?
Yeah.
Okay, go. Okay, good.
How's my lungs sound?
They are clear. You have
Okay.
no adventitious sounds.
Sounds good.
Equal expansion. Okay, now I'm going to listen to your heart. No, you're swallowing. I'm going to listen to your heart with a bell on my stethoscope. So I'm going to turn it around.
Okay.
And listen to your aortic valve, your pulmonic valve, herbs, tricuspid, and mitral. I hear S1 and S2, no S3 and no S4. Heart rate is equal. There is palpable. You can hear it. I'll palpate for any thrills. There's your aortic, pulmonic, herbs, tricuspid, mitral. Those are your valves.
Okay.
Now thrill. It's called a bruit thrill. You hear the bruit. You feel the thrill.
Okay.
For like a aneurysm.
Okay.
Okay. Let's see. What's next? Now you're going to. What did that do? You're going to listen to your apical pulse. Found at the apex. For a whole minute. Okay, it's been a minute. Good. Oh, 74. Alright, and then will you lie down, Mr. Sanford?
Yes.
Okay. I'm going to expect your abdomen, okay? Abdomen. I'm palpating. No deep palpation, just light palpation. Any tenderness?
No.
You're at a 35 degree. I'm going to listen to your heart again.
Okay.
With you laying down.
Do I need to lay flat?
No, I need you at a 30 to 45 degree angle.
Okay. Thank you.
No, thank you. I just auscultated your pulmonic, aortic, pulmonic, herbs, tricuspid, and mitral. Okay. And this is your point of maximum impulse down here at your apex.
Everything look okay?
Everything sounds within normal limits.
That's great.
Your apical pulse is normal. Sinus rhythm at 74 beats per minute.
Okay.
No heaves or lifts. Don't see any abnormality, no masses, no scars, no lesions, no bruising, no excessive moisture, no excessive dryness. I'm going to, there's no jugular vein distension, which could indicate right-sided heart failure. Not seeing pulsations with the head of the bed. 30 to 45. I'm going to. I auscultated each artery. I did not hear any sounds of a bruit. I'll auscultate again your aorta, renal, iliac, femoral. Now I did that on both sides. Femoral, iliac, renal, this aorta. I've palpated your liver and your spleen. No tenderness.
No.
Okay, you can sit back up. Now
Thank
all
you.
I'm going to do is palpate your costovertebral angle.
That sounds good.
Okay. You tell me if it's tender.
No.
Okay, good.
It's not tender.
Okay, good. I want to look at your joints, your hands for any edema, swelling, redness. Everything looks good. And palpate the joints. Palpate the joints. No tenderness, any nodules, no crepitus.
No.
Everything bends normally. Skin is warm with assessed skin turgor. No edema. Capillary refill. Less than 3 seconds. Bilaterally. And assess your radial. And air palpable. Assess your brachial. Artery. Okay. And can you do this? Can you do this? Can you do this? Can you do this? 3 times. Can you do redness, tenderness, edema in the wrist. No redness, edema, tenderness in the elbows. Can you do this? Can you do this? No hyperextension.
Okay.
Okay, you can put your hands down. Can you do this? Can you do this? No hyperextension. Can you do this? Right. Can you pull against you hold your arm, don't let me pull you. Okay. You push down. Don't let me push you up. Don't put, okay. Okay. Bilateral strength.
Lateral strength.
Bilateral strength.
Bilateral strength.
Can you flex your shoulders? Extend them. Flex them. No hyperextension. Okay. Can you internal rotate your shoulders? Internal.
Yeah, that's internal looking. That looks like a dog.
External. Pushing back. Okay. That's as far as we're going to go. Okay. Thank you. Your physical exam was normal. Everything looks good, Mr. Sanford.
So that completes my examination for today, Miss Amber?
Yes, from here to the lower abdomen.
Okay, thank you so much.
Everything looks good. I don't have any recommendations. Thank you for being my patient.
You're very welcome.
Mr. Sanford.
Thank you.
You going back to your junkyard?
Back to the junkyard.
How long was this video?